Hey everyone, I'm Nicole Hodges and I'm a wildlife ecologist with the Department of Wildlife, Fisheries and Parks. I'm also a board member of the Mississippi Bat Working Group. In this segment, I'll be discussing the diseases that affect bats and the ones that affect bats and people. The first disease I will discuss is rabies virus. Rabies is one of the oldest known zoonotic diseases. Rabies is a fatal but preventable viral disease. 59,000 people around the world die from rabies each year, mostly due to transmission from dogs. During the last 30 years, wildlife vaccination programs have grown in complexity in the United States as rabies in domestic dogs and cats has been eliminated in the Americas, leaving wildlife such as foxes, bats, skunks, and raccoons as primary source of the virus. Bat rabies is an emerging public health threat. Not all bats have rabies, but bats are responsible for most human cases of rabies in the Americas. We usually see 1 to 2 human deaths annually in the United States and Canada combined. Rabies infects the central nervous system of mammals, including humans, and causes inflammation in the brain. Virus transmission usually occurs when saliva of an infected animal is transferred to another animal or human through a bite or a scratch. Once clinical symptoms appear, the disease is usually fatal. Symptoms include headache, fever, sore throat, nervousness or confusion, pain or tingling at the site of the bite, hallucinations, hydrophobia, paralysis, coma, or death. So how can you tell if an animal has rabies? Usually they look sick, have problems swallowing, lots of drool or saliva, an animal that bites at everything, an animal that appears tamer than you would expect, an animal that's having trouble or may even be paralyzed, or it could be a bat that's flying during the day or found on the ground. So what can you do to help? You can protect yourself and your family by getting your pets and livestock vaccinated and by enjoying wildlife from a distance. Spay or neuter your pets. Call animal control to remove stray animals from your neighborhood. Always ask the owner before petting someone's pet. Never adopt wild animals and bring them into your home. If you find a bat in your home, like in your bedroom or living room, don't let it go. You're not going to be certain that it didn't bite you, and if you do have to go into the hospital, they would want you to bring the bat with you. If you are bitten, wash your wound immediately with soap and water. Always seek medical attention immediately. Your doctor will determine if you need post-exposure prophylaxis. Rabies in people is 100% preventable through prompt and appropriate medical care. Please note that rabies can only be prevented. There is no treatment, so you should take every precaution to avoid being infected with rabies. The last disease I will discuss today is the coronavirus. Coronaviruses have been around for decades, and there are many different strands that affect different species of animals, such as dogs, cats, horses, cattle, swine, chickens, and turkeys. The coronavirus that I'm discussing today is the one that causes COVID-19. To date, public health experts do not know how COVID-19 transferred from animals to humans, but now the virus is spreading directly between people. It has caused a global pandemic. The virus that causes COVID-19 is similar to coronaviruses that have been found in horseshoe bats in China, but the true origin of the virus and how it first infected people is still unknown. Horseshoe bats are considered what's called Old World bats and are very different from the species of bats that live in North America. The coronavirus that has caused COVID-19 has not been detected in any of the bat species found in the United States. Therefore, the Fish and Wildlife Service has asked all bat biologists to take extra precautions like wearing PPE, a mask, and gloves while conducting any priority surveys of bats in the United States. People with COVID-19 have a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. The following symptoms are associated with people that test positive for COVID-19. They can have fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Notice that several of these symptoms are also related to other diseases like the flu, so it's important that if you have these symptoms to go in and get tested for COVID-19. The best strategy of controlling any disease is to prevent it in the first place. So wash your hands often with soap and water for at least 20 seconds, especially after you've been in public place or after blowing your nose or coughing or sneezing. Avoid close contact. Stay at least 6 feet apart. Cover your mouth and nose with a mask when you're around others. You could spread COVID-19 to others even if you do not feel sick. The mask is meant to protect other people in case you are infected. Well, that's all I have for today. I hope you all enjoyed the presentation and learned something new.